Hello, my name is Valeria McNulty. I am the trainer for Linguava Interpreter Academy, and we are here today in beautiful Nehalem Beach, and we're at the Nehalem Bay Health Center, and we are with Angelica Godinez García. She is the Outreach and Community Resources Manager. And we just wanted to see if we can ask you a few questions about the great job that you guys are doing here. So, in your opinion, how do you, in your organization, currently assess and address language barriers in patient interactions, especially non English speaking communities?
Yeah, so I grew up in this area. I know a lot of the people who access healthcare just through my personal life. This is a very small rural area
Mhm.
where everybody knows everybody. And so, fortunately, a lot of people are comfortable coming to me with any of their patient experiences that they've had accessing healthcare, and they're comfortable letting me know some of the challenges that they've been having. Um, Fortunately, I've had supervisors who support me in the work that I do and with handling some of these situations. And the health center takes providing language access and doing it in a trauma informed, meaningful way very seriously. Yeah, so we work with Linguava.
Mhm.
You're the only interpreter service vendor that we currently work with. And we try to bring out interpreters if we can in person. That's always the best case scenario. Patients let us know that that's what they're most comfortable with, and I think it really helps with some of the nuances of working with interpreters. But being in a rural area, we can't always have in-person interpreters, so then we also work with video interpretation and phone interpretation. And that's been working well with us because it's an on-demand service, so we can reach out whenever we need help, and we don't necessarily need to schedule somebody to come out here.
That's amazing. And thank you so much for using our services. And what community outreach strategies have been most effective in improving trust and communication with patients who have limited English proficiency?
Yeah, so I am a community health worker, and a bulk of my work is also outreach and enrollment. I'm certified Oregon Health Plan assister, and I can also help with marketplace insurance. So there's a big emphasis on healthcare system navigation and really going out into the community, having a physical presence in the community and meeting people where they are, and also collaborating with partners who serve the mutual patients, and really working with them to help reduce the barriers that our patients are experiencing. So one of the partners who I work with is the Mexico Consulate of Portland.
Mhm.
We bring them out here once a year to bring their mobile services to the community because, again, we live in a rural area where transportation is a big need. And so if we can reduce that barrier for people, then it really helps them to be able to access the services that they need. So, yeah, just really listening to what people need, rather than telling them what they need and how they need to access care, and collaborating with our partners to try to address those barriers so that people can actually get the help that they need.
Yeah, that's excellent. Thank you. And can you share an example of how language access services, for example, interpreters or translated materials and stuff like that, have positively impacted a patient's healthcare experience? Can you think of one example?
Yeah, so one of the things that we try to work on is communication. So we have worked to translate and have all of our signage available in multiple languages, specifically English and Spanish, because Spanish is the most common additional language that we have in this area. Um, and we also do that with any of our anything that's it's publicized so that our patients and community members can understand what it is that is posted throughout the health center. Yeah, so also having interpreters and offering the
Mhm.
interpreters, not keeping that service a secret.
Mhm.
um, our patients have appreciated it, and it also encourages them that we are going to be able to help them and that we're willing to help them, because oftentimes when language access is not a service that is offered, people come into their appointments not feeling well, having to pay for the service, and then not getting the help that they need. So if they know that we're at least going to try to make sure that they're able to communicate with their providers, and they have a successful experience with that, a positive experience, then they're more willing to come back and engage with their care and really, create the most healthiest version of themselves moving forward.
For sure, that's so important, right?
Mm-hmm.
Yeah, and today we were able to experience the amazing work that you guys are doing. We were doing training for your staff, and we saw all the uh, procedures that you have in place already. And so, how do you train your staff to ensure cultural competence and effective communication with diverse patient populations?
Mm-hmm. Yeah, well, first of all, it comes from the top down. So we had to get buy-in from our executive director and also the managers, because I think that oftentimes when people are monolingual and they've never, been in the situation themselves where they're experiencing, where they feel like they're the ones experiencing the language barrier, it's very hard for them to understand the hardships and how traumatic it can be as somebody who is a limited English proficient to come into an office where everybody speaks English or a different language, and they can't, it's uncomfortable for them. So that was the biggest thing, was buy-in. And then also, one of the things that we like to cover is really offering a meaningful experience to our patients. So being able to, do the tech part of it, being able to connect with the interpreters is only one piece of it. There's so much more that goes into those interactions that are so important, so critical, and really making sure that the patient has a positive experience. Like, for example, earlier we talked about how sometimes when there's a language barrier, we just subconsciously try to overcompensate for not being able to communicate verbally by like speaking louder, or sometimes people get nervous and they laugh. And so while those are all natural reactions to being uncomfortable or not being able to communicate with each other, with another person verbally, it can make the patient feel very uncomfortable and not seen, or feel like we are making fun of them, or like we're yelling at them or being rude, and really that's not the case. So that's one of the things that we like to emphasize on, is really trying to offer trauma-informed experience for our patients, and making sure that our staff is aware of those nuances that you might not pick up automatically if you've never been in that situation before.
Yes, thank you so much. And this is the last question. What challenges have you encountered in providing equitable language access, and how have you worked to overcome them?
Yeah, so I think, again, opening up staff's hearts to really understanding the trauma-informed care aspect of it has been a big piece. We've come a long way. We've got a ways to go still, but yeah, having that buy-in from upper management who can continue to reinforce the need for working with interpreters and offering the service. There's also been we live in the middle of nowhere, so getting interpreters out here in person is typically a challenge, and it's really unfortunate. But the good thing is that technology exists and it's advancing, and so being able to connect with interpreters on demand via video or telephone has been huge for us.
Well, thank you so much. Thank you for taking the time and answering those questions and sharing your thoughts with us. And now we get to enjoy the beautiful day.
Yay! Well, thank you for coming out here.